Hello and welcome, and thank you very much for your time for today's lunch. We're just doing a high-level health and life sciences thought leadership lunch. Hopefully we've got an exciting panel for you. I'm Jonathan Kershaw. I am one of the product directors here at Vonage. I'm joined by Saul Fofana, who is Chief Customer Officer, we'll do introductions properly in a moment, at Penrod, and David Stern, who's CEO at Boston IVF. So today we're really going to be thinking about, a patient-centric world in the health and life sciences world and how we can actually build that and looking forward to the future. But before we go into it and asking a few questions, Saul, if you wouldn't mind just briefly introducing yourself.
Yeah, hello everyone. My name is Saul Fofana. I'm the Chief Customer Officer at Penrod. We are a Salesforce implementation partner and consultant who's focused solely on the healthcare and life sciences industry. I've been on the people side of software for about 15 years now, really into storytelling and the ways that we can really truly empower exceptional experiences throughout this industry. So really excited to be here.
Brilliant.
Today.
Welcome and thank you. David.
Thanks, Jonathan. I'm David Stern. I'm the CEO of Boston IVF. We are a fertility provider. We help people get pregnant and have babies who can't have it on their own. I've been in women's healthcare and fertility for almost 30 years, majority of that time actually on the biotech side, and bringing products to market, bringing new technologies to the field, and joined the provider side about 3 years ago, trying to bring some of the innovation to providers so that we can understand the patient experience and provide customization so that as they're going through this very emotional journey, they're able to do so in a little bit of an easier way.
Brilliant. Thank you, and both thank you for your time today. So, today in the world of healthcare, I think we all realize patient expectations are rising and increasing all the time as they are in any other industry, So we want today to basically think with our panel about what you want to be doing and how you can guide others in terms of trying to drive that patient-centric experience in basically a hybrid healthcare world. So that's sort of the context of where we're going today. So with that in mind, one thing we'd like to do is, so Saul, I'd like to talk to you and just say, how should healthcare providers be basically thinking about, where to, invest to create that personalized patient experience?
Yeah, so from a personalization standpoint, it really has to start with actually knowing who your patient is and getting that data and truly understanding. You can't really personalize anything if you don't really have that comprehension and understanding. So it's funny that this is kind of the first question. We didn't anticipate this in preparing for this, but with Brett Taylor and Salesforce releasing the Genie platform yesterday, it's all about personalization. So it's a very topical thing that we can kind of real-time react to. And we've been spending a lot of time at Penrod and working with customers and understanding what a customer data platform can really do for them in terms of personalization, and really being able to deliver experiences that can collect data from a bunch of different sources, connecting into your EHR, understanding your CRM data, understanding social engagement of your patients, understanding how they use your website, and building a customer or patient profile that you can truly market to. I know I get really generic emails from my provider all the time that have nothing to do with me or my care or anything that I'm really interested in. And being able to personalize those things from something as simple as an email to knowing who I am when I visit the website, so you're really serving up the content that I care about, is really important. And I think that retail and finance and B2C companies have figured this out a long time ago, how to segment, how to message. And I think it's definitely long overdue from the healthcare perspective. And a lot of it comes from the debate around whether or not we should be treating patients like customers or treating them like consumers of care. And there's a really good, healthy debate going back and forth about what that means. And I think in treating them simply like a patient, what you're getting is best-in-class technologies around diagnosis and treatment, and truly that really patient experience. But when you broaden it out, it's the journey that's really lacking around that that can really hamper you. Without one, you can't have the other. And so I think that's really kind of an important part.
And I like the way you said debate, because having a provider and an implementer, we're now going to get quite an interesting dynamic. So I'll hand the same question to you, David, please.
It's a really interesting question, and this is my first Dreamforce, and listening to some of the talks, I think people are still trying to figure out where is a patient from a healthcare provider and where are they consumers. And expectations of people have changed. Depending on the age of your patient, what are your patient base? Younger people, millennials, have an expectation that they want to be interacting with healthcare providers the same way they interact with when they're buying something online. And so we have a new standard to go up to provide that type of experience. Even, COVID is a great example. I was in a couple talks yesterday understanding how the pandemic has elevated people's expectation, thinking about being able to schedule vaccines online. From a patient standpoint, it's very frustrating if you want to go do a COVID test and you can't find anything. But we've been conditioned to go online and to find self-scheduling. So being able to customize that experience for yourself now sets the bar higher for healthcare providers to say, we need to provide this to them, because it used to be healthcare was like, okay, you go to your doctor, you're sick, you go, you get treated, and that's it, you don't have a lot of choice. In today's healthcare environment, there is a lot more choice. And so we are competing as a provider for our services. We're competing in the Boston area with 5 or 6 other IVF centers. And when we go outside into other markets and we've expanded, we're constantly look to be capturing patients, identifying them, and bringing them into our services. And so one of the things that we try to do is to empower our providers to give them a better experience. We do it through our call center. We utilize Salesforce to be able to prompt patient journeys, so that we're trying to give them information that they need when they need it.
Yeah, and that experience really matters too. I have a friend, a couple that went through IVF. They had a really poor experience going through the process with the provider that they chose at first. And it wasn't that they couldn't, do the job or help them conceive. It's that the experience was really poor. They treated the husband in the relationship much differently and a little condescendingly. And so they went out of state. They have traveled across the border multiple times, an extra hour and a half, wow, to get the treatment or the experience that they were looking for, even though the result, would have been the same. So.
Yeah, it's very interesting also because we have some of our providers that are younger. And so in today's world also, we use a lot of digital marketing. We use Facebook, we use Instagram. We haven't gotten to TikTok yet, but we have providers that have patients, and when the patient comes in, they feel like they know the provider because they follow them on Instagram. And so what's really interesting about this dynamic is they trust, that level of trust is taken up a notch. And when the doctor says, this is the treatment that I think is best for you, because they've had that relationship totally digital, they feel like, well, that doctor knows me better, I know that doctor, and I will listen and trust that provider because I know a little bit more about them than some of our other providers that it's more of a transactional.
Yeah, my primary care provider plays bass guitar, and I love him for it. And so I'll be with him for a long time.
That wasn't one of the questions I had written down. Yeah, any particular band, but it's interesting that you're sort of coming at it from a engagement, what people like, sort of from an outside-in perspective. But one of the things, and you talked about the personalized experience of just random emails, you're saying you need to engage with people, but from an inside-out perspective, what are those key KPIs that you'd be looking? And you also said that bars are going up and up and up. So what are those key KPIs you're looking at from an acquisition, retention, engagement sort of perspective you would be applying?
Jonathan, a lot of healthcare providers don't even think about KPIs. It's a very business-oriented approach. And one of the things, having been for the majority of my career in the business side and running organizations and divisions, we're constantly looking at our own KPIs. And so coming into a medical practice, thinking about what do we want to look at? And a lot of practices, don't necessarily look at acquisition of patients or think about it in that way of an acquisition of a patient. But we now look at how we're spending our money. When we're doing digital advertising, we're looking to see, when we're investing in a search engine optimization, how efficient is that? We're investing in that, so we should understand, are we getting what we expect to get out of it? We're looking at referral base. So infertility is a tertiary. We get OBGYN referring to patients to us. Sometimes we'll get primary care, but we track those referrals by OBGYNs. And so that's another KPI where in the past, a patient would come and you'd say, yeah, they were referred by this OBGYN, that's nice. Now we actually look to see who are the OBGYNs that maybe haven't referred in a quarter. And we have a liaison team that can go out and we provide CME, we provide grand rounds, those types of talks to solidify the relationship with those referring providers. And then the other KPI that we look at is when a patient comes in and makes an appointment, what do they do? Do they show up to that appointment? Do they abandon the appointment? If they abandon the appointment, then we can actually send a journey to them, ask them if they would want to speak to a nurse because they have a question. When they do an appointment and don't go into treatment, we do a similar type of thing. And we've seen that when they do ask the nurse a question, about 35% of the time, they'll actually come back into treatment. So we essentially rescue that abandonment, and it's a KPI that we look at. We look at new patient starts, we look at location, we look at wait time, all of these things that we do, especially during the pandemic, when we started to open up, we had to close most of our satellite locations, and we were looking at people calling in, where did they want to go to see the doctor to be monitored, and we knew how to staff different offices based on those KPIs.
Okay, that's fascinating, and I think that's obviously you as a provider looking at it from that point of view, but I think from an implementer, do you see similar sorts of KPIs and metrics, or do you make it?
And David, I was going to ask you too if you saw patients as a referral engine as well, and if you're tracking any of that too.
We absolutely do. In fact, so we are able to differentiate, again, using Marketing Cloud. When a patient comes in, if they're coming in from a provider, an OBGYN or a primary care, or a friend and family referral, 65% of the time they're going to go into treatment. If they're coming in from a Google ad or something online, they're more like 35, 40% likely to go into treatment. So it's much more of because they have a trusted provider or a friend or family that's referring them, they're much more likely to become a patient of ours. So we absolutely do track that, and we send surveys out. And if someone has an excellent experience and they're ranking us as 5 out of 5, we then ask them to do a online review. So that other patients can see the great experience that those patients have had.
Yeah, absolutely. And we see a lot of what David is doing in the implementations that we're doing. So it's a lot of the same metrics, like you said, that the providers aren't very KPI driven. It's the same things that a lot of other traditional businesses are doing. It's patient acquisition, it's patient churn. Are we losing them in attrition? Even now, not even knowing that you can truly leverage the data of how people are interacting with your website, how people, if you do have a patient portal that people can log into, are they actually using it? How do you leverage that utilization against your call center volume? Can you even those things out? Can you shift them to one side or the other? Or if you think you have a great portal experience, but your call centers are still overrun, shifting that self-service education and marketing and getting better utilization out of it is really important too. So I think those are some really big things, just being able to measure the tools that you already have in place. Same thing with surveys, a really, really big thing for us. And I was asking about patients because simple, tried and true measurements of things like retail, NPS, Net Promoter Score, your likelihood to recommend is really important. I mean, I've recommended 3 other friends deliver their baby at the same hospital I did because it was amazing. It was an amazing experience, and I would tell everyone. So yeah, I think that's really important.
Okay. So you've basically been talking about recommendations, missed appointments, journeys, contact centers, personalization. And you even use the word tools, so that's a massive selection of things. So simple question, potentially huge answer, bearing in mind where we are. How do you use Salesforce? I know you talked about Genie, but where does Salesforce fit into that?
Yeah, I
said it was a simple question.
How do you use Salesforce? So I'm excited for David's answer too, because he uses it as a provider. We do a lot of implementation, but we're doing some really, really innovative things that you don't even think of Salesforce as a CRM can do. From that whole acquisition retention survey perspective, we work with companies who do things like blood donation, and the fact that they need to A, get people in and excited to donate, B, they need to keep them coming back, and so putting them on marketing journeys and automating that experience to say, hey, here's what to expect. Hey, here's when you come in. If you show interest and then disappear, how do we bring you back in? What type of messaging is going to going to allow you to come back in. If you donate once and disappear, how do we get you back? How do we share like the impact we're having on the community and all the cool things that you can do with this? So pieces like that. Also, just like thinking about like bottom line numbers, we're right now working on a subset of marketing. Again, you don't necessarily think about marketing. Vonage could do probably a similar thing with the omni-channel communication that you can have from that digital perspective, but taking a look at things like elective surgeries and taking a look at maybe those top 5 from value, margin, cost, and what it truly takes to bring in a surgeon and a team to perform an elective surgery, and all the steps that a patient has to do to prepare for that surgery. It could be being on a medication, when you stop taking fluids, all those sorts of things. Only for that surgery not to happen on a Monday morning because somebody ate breakfast is a really, really huge cost for a provider. So being able to, in any way, increase the likelihood of these things happening on time and on schedule is a really, really big cost savings, and also helps you get reimbursed from insurance and things like that too. So like there's a lot of cool different healthcare use cases that come from, again, some of these traditional, how do we capture and retain customers in that B2B or B2C landscapes that we're doing right now that are kind of exciting and you don't think of when you think of just CRM.
Okay. Which, just to add to that before I come back to your thing, I assume if that is your single source of truth, and from all you're saying, you then want to do proactive outbound communications. I assume, and you kindly alluded to Vonage, and I guess having those, APIs just say send that message at the right time, listening at the right time, on the right channel. But I guess also being able to communicate sort of, we keep saying contact center, but to the back office as well. And then obviously being able to drive, I presume, a more personalized experience with the contact center as well, using that, knowledge, data, whatever it is, personalized profile. I think you were talking about Genie earlier, to ensure that when the call comes into the contact center, we are giving you at least to the right place. So it seems quite a well-balanced approach, having that Salesforce at the heart, the communication, whether it's inbound and outbound on that. I mean, David, back to you on the Salesforce, just...
I think a lot of healthcare is still very transactional. We don't necessarily think about the lifetime value of a patient like business people do. And a lot of healthcare also has been maybe afraid to embrace technology. So one of the things that I think Boston IVF is a little bit more forward thinking in utilizing Salesforce for our call center, for patient acquisition, being able to, we run Marketing Cloud, and where we actually fall down is we've got a great picture of acquisition and patients coming to go and visit a provider, and we know out of multiple offices, we've got 15 offices and we can see where they want to go. But then when it gets to the clinical side in our EMR, that's where we fall down, because our EMR does not interact with Salesforce.
Okay.
And so one of our frustrations is we have all this great information up front, but then once they become a patient and they're going to treatment, we don't have the ability to, we're actually looking to build an app in Salesforce for our patients so we can communicate with them. We still do a lot of old-fashioned communication, a lot of phone calls, which is so frustrating because when a lot of our patients are in their late 20s, 30s, early 40s, they're professionals. So our nurse will call them at 3:30 in the afternoon with instructions, and they're in a meeting or they're at work and they can't take the call, so it goes to their voicemail. And then they call our nurses back and our nurse is on the phone and it goes into the nurse's voicemail. And so we have this voicemail hell, and one of the biggest complaints that we get from patients is I can't get in touch with anybody. And so we really see the opportunity of utilizing an app or a portal with Salesforce to be able to push information out to them, acknowledge that they receive their instructions, because every day it's a very customized, specific treatment. So depending on how that person's hormone levels are, their dosing of drugs will vary. Their instructions to take one dose versus another dose varies. So by pushing that information out to the patient when they need it, have the patient ask a question, again, all of this done in a Salesforce app environment is an ideal state. And we actually just last week, during one of our phone calls that we had prepping for this, we had a full morning session with our Salesforce team to talk about what does a journey look like, what is our ideal state, where are the barriers, how do we knock those barriers down and utilize that. And that's one of the things that actually I was very impressed that our Salesforce partners worked with us to do that. They brought people to the room for a 3-hour session, and we talked about, what a best case scenario was. We actually don't have a lot of examples to follow in our space. There aren't a lot of fertility practices that use Salesforce. So we're looking to see, are there other apps that we can work with or understand how to be able to do that.
Okay, fantastic. And I think it's interesting that you're saying about them contacting you. And obviously, we don't just look at healthcare as Vonage, we look at elsewhere. And other people, you're buying online or whatever, expectations are rising constantly. You're talking about apps, there's those other challenges. So how are patient expectations, changing? You've said voicemail, you've used voice, but are they, expecting to communicate with you differently, albeit with something at the heart?
Absolutely. I mean, one of the amazing things that I think, because we're living in such a digital world, that patients' expectations are, and we hear this from patients, why can't I interact with you like the way I interact with Amazon? If I want something, there's immediacy. I can go to my phone, I can plug in whatever I need, and we have this immediacy. And quite honestly, a lack of patience, not patience, healthcare patients, but like patience in we don't want to wait for things. And so what used to be acceptable is no longer acceptable, because we're experiencing this in our everyday life. I've had personal experiences where, for example, I heard one of the talks yesterday. I just went to a new dentist. I moved to a new area, was recommended by somebody I work with for that dentist. Oh, this is a great dentist. So I went online. I set up my appointment online. I filled out all my medical history online. They actually texted me and said, you can't come in for reminders 3 days from now. You have an appointment. You cannot come in until you fill this out online. Here's our COVID policy. You're no longer coming into a waiting room and filling out paperwork. That's changed because of the pandemic. So I had to do everything online. And then I got there, I waited outside, they brought me in. And it was actually a fantastic experience, because I didn't have to sit in a waiting room and wait. When they were ready, I sat in my car, I said, I'm here. They came out, they got me, they brought me right into the room. The dental assistant told me what to expect from that day. The dentist came in, I saw the visit, they did a scan of my mouth, very cool technology stuff. And then at the end, they walked me through as a new patient, here's our office. And at the end, I made my appointment, got it scheduled online, and gave a review. Okay. So this whole experience is so much more digital, and there are other areas of healthcare, I think, that are taking advantage of it.
Okay. Which, to use, I guess, language you would have used in other industries, I'm hearing frictionless, zero touch. I know it's medical, but it's just seamless and frictionless. And why would you go?
It was a great patient experience. Yeah. And now I will go and recommend that to other people the same way that office was recommended to me.
Yeah. Anything you want to?
Yeah, and David, I love your anecdote about being called in the afternoon. I am literally in the middle of a call center loop that I can't get out of, and it's been 3 weeks trying to reschedule my son for his 3rd COVID shot. And so I call the call center. They don't allow me to schedule directly with the clinic, so they ask me what I need. They take in all my information for the 5th time. They leave a message for the pediatrician, who then calls me to schedule, which is always in the middle of a meeting. And so I'm on my 3rd round of this, and I've asked them, okay, the process is the process. That's okay, that's fine.
Is this a healthcare system?
This is a healthcare system,
okay.
Yes.
So there's not a good interaction between the main healthcare system and that pediatrician?
No, not at all. And so I actually told them too, I was like, they called when they said they had an SLA, right? We'll call you within 24 hours. They called me within 24 hours. It was 1 o'clock in the afternoon. I was in a meeting, but they don't take that extra step to call back. So it's clear there's a gap in their digital strategy that says this task is not done yet. This case isn't done. This patient hasn't been fulfilled yet. I'm sure here's the voicemail, call this person, voicemail's gone. There's no other follow-up there. And so I'm to the point where if they call me during this panel, I will leave the panel and take the phone call, because I don't want to do this for another week. So that's a really interesting point there from that standpoint. And then you brought up the patient intake process, which I would have snuck in into another question later, but I think that's such a huge thing, and like how people can start here too is that first interaction, that first engagement. A lot of times is the clipboard they hand you, which I still fill out every time I walk in, and that's, I mean, 90% of the implementations that we're doing are starting with patient intake. It's such a great spot. So great way to digitize and to really meet your patients where they probably are.
I think that's one of the areas. It's an interesting debate because I was at a talk on Piedmont yesterday, and my chief operating officer is at the conference with me, and we were talking about what is a patient expectation, and is that impersonal? Does the patient want to walk up to a kiosk and do it, digitally scan a QR code, or do they actually want to have a receptionist who meets with them and says, okay, this is what I'm here for. Oh, you're here to see a surgeon, the doctor. You're here for a blood test. Here's where you go. And so in our business, we've said, we actually don't like the impersonal aspect of a kiosk. We want to have that person interacting with the patient and giving them the information they need, because if you are there for a blood test, it's different. You don't have to wait. You go into a different area of the office versus a surgical procedure where we do need to make sure, okay, yeah, you're checked in. You'll go wait there. They might ask you some questions just to verify, like you were saying, you didn't drink or eat, so we can go through the procedure and some of these things that are done by the human being as opposed to through a kiosk.
Yeah, and it's a delicate balance between, like, we're saying hybrid, right? We still need this personal touch, and we also need to get rid of the things that hamper the experience. And so I think that balance is really important. Like, I want to talk to somebody when it comes to very specific things, and that mantra should be like, when you need us, we're there, right? It's just like at what time, and just the ability to text your doctor. Like, most people actually have that capability and probably have never used it, right?
So I guess it sounds like you're considering the future and what's coming, and that's the next bit. But any insights on what the future does hold? In the past it would have been purely person to person, but equally you're advocating person to person in the future. But we've just talked about all those different technologies, WhatsApp, SMS. How does that balance, and how would you see the future? For other people to consider, and what might they be considering?
I think 5-10 years from now, one of the biggest challenges, and you've heard this throughout this conference, one of the biggest challenges is digital health information. When we have a patient who's gone through our care, or we're getting somebody in as a second opinion, the patient is required to bring all this information with them, and to request those records, and to get the record from an OBGYN or the primary care or from another IVF center when they come to us. And then they come with a file like this that they have to upload to us. They either have to scan it or PDF or whatever, and it's very inefficient. So I think the future is really that we're all gonna have our own health records that we own. And so when I'm moving to a new provider, it's something, whether it's a blockchain or we're actually working with blockchain to do identification of frozen eggs and frozen sperm and frozen embryos. So we're working with a blockchain provider, which is kind of very cool, cutting edge. But I think that's the future, is we're all gonna have our own personal health files in a blockchain that makes it easier for us to go to physician practices. And I think a lot of it will be digital self-serve. The whole idea of telemedicine, which no one thought of before the pandemic, is now regular. And there's certain things that we want to see patients in person. It's harder to do a physical exam, obviously, through telemedicine, but there's some follow-up visits that can absolutely be done telemedicine. It's more convenient for the patient, it's more convenient for the provider. So I think that's here to stay. And a lot of that digital life that we live in 5 years will be commonplace in healthcare.
Okay, so I'll almost be able to scan you with a QR code and truly know me. I know that's what people talk about in contact centers, know me, but this is know me at a really deep level.
And one other thing, so one of the things that we saw, which is a great opportunity for us, is unfortunately people sometimes have bad outcomes. And for us, a bad outcome is a negative pregnancy test. And sitting in a session on behavioral health, we have a mental health group within our practice. But oftentimes, we don't suggest to the patient. The nurse calls and says, I'm sorry, but you have a negative pregnancy test. And that's kind of it. what we see as an opportunity is having an app which says, unfortunately, you have a negative pregnancy test, or you might have had a spontaneous miscarriage. Would you like to make an appointment to speak to one of our mental health professionals to help you through? Because it's a very emotional stage, and that's a great opportunity to help close the circle and provide the patient with additional mental health benefits, which we really don't do today, and we don't take advantage of it.
Which I guess is a prime example of hybrid, where you need to blend that with technology's great, but it only goes so far.
Absolutely.
With that. Okay, fantastic.
Yeah, and I think that road to that next 5 to 10 years is going to be really bumpy. A lot of providers, a lot of people that we worked with were thrust into telemedicine, thrust into web chatting, thrust into these tools, and there's got to be a little bit of grace extended. I remember one of our clients during the pandemic, you'll love this being a call center focus, as soon as the pandemic hit and they had to send everybody home, this is a company out of New York, they had all of their sales, their support representatives take their tower desktop computers home with them to set up. And there were people on the subways with their towers taking them home to try to set up their call center remotely. So just crazy stuff like that. And it's true, like the digital strategy isn't done because you figured out that you can do telemedicine now and things like that. So there's definitely a lot of gaps in that strategy and making sure it's end to end and not, well, like this is a really great hybrid model, but this part of it isn't. Like falling in and out of that journey and not knowing what you can or can't do in a portal, in person, through self-service, et cetera. It's going to be a lot for like everybody to learn together.
Okay. Which I know we talked about where do we want to go, and you're alluding to the challenges of the future. And I don't mean just carrying your computer, but what are the business challenges that are out there, or the healthcare challenges as you look forward to the future? Not just, where do you want to go, but what is challenging that next step forward?
I'll give you, from a provider standpoint, one of the biggest challenges we have is investing in technology, and we're reimbursed in Massachusetts and in upstate New York and in the New England area where a lot of our practice is based. We also have offices in Ohio and Utah and Delaware and North Carolina. But insurance companies pay us to do procedures. And one of the biggest challenges we've had in this economic environment is our costs have skyrocketed. Since the pandemic, we've seen a 19.6 increase in our internal costs to deliver care.
Wow.
And our reimbursement is increasing at 2%.
Okay.
So, and you look at hospitals today, a lot of hospitals are losing money every quarter. They're losing money because this is a challenge for us. So one of the big questions is, how do you pay for the technology as a healthcare provider? And one of the biggest questions that I get from our physician shareholders is, we're spending a lot of money on Salesforce. Where's the value? What are we getting in return?
Yeah.
And so it's very hard sometimes to say, well, we got an extra 10 IVF cycles because we're using Salesforce. We can say, yeah, we've been able to plug some of the holes in patient acquisition and losing patients, and we're avoiding some of the leaks. But I think that's the biggest challenge, is making these investments, because we know it's the right thing to do from a technology standpoint. It's how do we invest in it and be able to get to that state that we want to get to.
Yeah, and a lot of that internal buy-in that you have to do in providers or like networks that are like larger than yours, David, even, is that we're often struggling with who is actually setting and building that vision from a technology standpoint and connecting all those dots. We have IT teams and providers who are typically under-supported and are supporting legacy systems, and then we have our stakeholders who are typically medical doctors who, we have to wedge that gap and bring people together, and we've seen it most successful when people are not only implementing or investing in the technology, but investing in that core team of champions who's truly going to build and sell internally why we need to do things, understand ROI for the first time ever, do those sorts of things, and really have people who are willing to knock down doors and kind of stamp their feet and make sure that adoption and these things actually happen, because it's the change management and the adoption of the investment is so important to even deliver that experience that you're looking for at the end. So I think that's another big challenge, is just having providers understanding that like you're now a software company too, right? You're now delivering a product if you're delivering an app, and it's not a project. There's no start and end date where you're live. It's a product that's living and breathing and always has to be iterated on and tested, and you have to have some agility around it and support around it. So you're hiring software developers, right?
Yeah. We brought in a Salesforce administrator because we very quickly recognized after a year of working with Salesforce, we didn't speak the language.
Right.
And we needed an expert to come in, and we brought in someone who actually hadn't been in healthcare, but at least understood what Salesforce could do. Because as healthcare providers, a lot of our team are nurses and embryologists and physicians, and don't know the language of Salesforce, and can say, we want to get to here, but we don't know exactly how to get there.
This has been fantastic, and thank you for that. And I have personally learned so much, ignoring the fact that I'm clearly British. We have a different healthcare system, but obviously working for an American company. But I suppose, we were coming at from the context of communications, but actually suddenly I hadn't appreciated until today how important that word hybrid truly is with the technology that we talked about, the future going forward, but it's just such an incredible balance to achieve that the technology is just an enabler for that, but the person, the human, is still absolutely key. So thank you very much, both. And I'd just like to open up if we've got any questions from the floor. Otherwise, I just thank everyone for their time. No? Thank you very much, gentlemen.
Thank you,
really appreciate it. Thank you.